Laron's syndromes. It is an autosomal recessive disorder caused by defective growth hormone receptors in the liver, and that is decreased, which leads to a decrease in growth, linear growth of the patients. The patients usually appears short, proportionately short stature. The mechanisms of Laron's syndrome is the defective in growth hormone receptors, which leads to an increase in growth hormones because growth hormone is released from the anterior pituitary gland, but the receptor is defective, therefore it does not respond to growth hormones, and growth hormones builds up. Since the growth hormone receptor is defective, it does not stimulated, or it does not respond to the Janus kinase and STAT5 secondary pathway the growth hormones to release insulin-like growth factor 1. Therefore, there is a decrease in insulin-like growth factor 1, which leads to the decrease in anabolic growth process and bone growth, which leads to a decrease in linear growth of the patients. So the administrations of growth hormones, so with treatments of Laron's syndromes, we use biosynthetic insulin-like growth factor because administrations of growth hormones has no effect on insulin-like growth factor 1 productions because there is a defective in growth hormone receptors. So therefore, the treatment is mainly by biosynthetic insulin-like growth factor 1, and insulin-like growth factor 1 must be taken before puberty for it to be effective.